Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Bostix Titus issue, audio podcast as part of an Analytical Storm, an audio podcast as part of the SZtorm, and another Storm of Bostix production. In this overview, and this audio podcast, and this overview, and this audio podcast, and as part of this overview, there will be basis in around the results and some of the analysis in around this works between the analysis between some of the analysis that had taken place between the two social media platforms as part of this works from 2000 and 2021, and as part of this audio podcast series. So the one of the social media platforms, one of the social media platforms at the time had 8,000 service users or 8,000 service users or members, and the second social media platform had at the time just over 1,500 members or service users, members at the time, and where between the social media platforms have represented an international or global membership, and between the two social media platforms. Between the two social media platforms, 2,560 threads were tagged against 14 topics, 14 themes. One month of tagging between two social media platforms prompted uh, prompted um, prompted prompted a basis of data that represented um, uh, uh, the themes and a basis close to decades, thus being in around 16 years, more 16 years, more specifically, in understanding of some of the most important gaps in patient education that still surround pediatrics and young people, and those in the adult population in context of nephrology or kidney care. And the results had informed that patients between both adult and pediatric or young people cohorts still require additional support across several areas of practice, and the data provides a snapshot of where healthcare education has been neglected for patients, for patients or service users. And results also inform that the social media platforms between both cohorts are only as effective as the admin and moderators, as effective as the admin and moderators, and 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 the research team who help drive patient inclusion and involvement, and in around the sort of analysis or what's referred to as the descriptive analysis, in around the in around the adult patient population or nephrology patient population. Topic tagging for 2 weeks, descriptive analysis revealed that three of the most prominent online topics surrounding in around kidney care for adults relates to renal replacement therapy, for example, dialysis and transplantation. And at the time, there were 166 tags, 166 tags in around 12 point just under 13% or 12.66%. And second includes lab tests and biomarkers, 137 tags, just under 11%, 10.5%. And third includes medication and pharmacy in around 135 tags in around 10.29%. And topics were applied were applied over a 2-week 2-week basis between March 2020 and April 2020. March 2020 and April 2020 in around the adult nephrology population on one of the social media platforms. In around the pediatrics and young people's population, online population on the social media platform. After topic tagging for 2 weeks, descriptive analysis revealed 3 of the most important online topics surrounding kidney care or nephrology care for pediatrics and young people relates to medication and pharmacy, 148 tags in around just under 12%, 11.85%. Second includes renal replacement therapy, 133 tags, in around 10.65%. So just under 11%, 10.65%. And third includes peer support, where 125 there were 125 tags and representing just in around 10%. And fourth includes nursing and 115 tags in around 9.20%. And in around representing in around sort of over looking at the data from a decade looking at the data in context of the looking at the data from in around the adult nephrology population online on one of the main social media platforms, conducting a 10-year retrospective descriptive analysis of topics and tags also helped reveal most important topics and trends. The most prominent topic in 2020 focused on renal replacement therapy, wherein there were 39 tags in around 23%, 163 in total. And 2014 and 2015 focused on lab tests and biomarkers, and where there were 44 tags or 32%, 137 total. In 2019, one of the most prominent topics was in regard to medication and pharmacy, wherein there were 20 tags or 20 tags, or in just around 14.92%, or just under 15%, 134 in total. And additionally looking at nutrition, wherein there were 28 tags and around 24 24.34%, 115 total. In 2015, biopsy and surgery was important, wherein there were 18 tags or 19%, 19% or 97 threads in total. And lifestyle was a leading topic in 2020, wherein there was 24 tags, or 23% and 92 threads in total. And in 2015, also psychology was a critical topic, for most service users in the adult nephrology social media, in the adult nephrology patient population, in context of the social media platform, where there are 14 tags. 14 tags, and or 16.5 percent, or and a total of 85 topics tagged. Trend also revealed that wellness and well-being in 2020 was important, and there were 24 tags, or 29.26%, and a total of 82 tags. In 2015, also topic trend also revealed that nursing was important. Nursing was important, where there were 14 tags, or 20.28%, and there were 60, just under 70 tags in total. In 2015, also in 2015 also highlighted that that physical activity was popular or important, where there were 13 tags, and around 20.31%, and 64 threads tagged. And in 2014, there were primary in 2014 primary care was important. There were 12 tags, there were 12 tags, and around 18.75%, and 64 topics tagged in total. And in 2015, also electronic patient records was important, had been important. There were nine tags, or just around 18.36%, and 49 threads in total. And in 2013, 2013, peer support was the most popular, and there were 8 tags, or in around 20.51%, wherein there was and 20.51%, and 39 topics, 39 threads tagged specifically. In around the pediatric and young people population, the data was over a 6 year, also over a 6 year from a 6 year basis, wherein there was a 6 year retrospective descriptive analysis of topics and tags through the social media platform, and helped reveal most important the most important topics and trends over a 6 year duration as well. Most topics tag highlighted, for example, in 2019, was first and foremost was the most important year for the social media platform, and focus and the the most prominent topics in 2019 focused on medication and pharmacy, wherein there were 43 tags, or around 25.67%, and 148 topics, 148 threads tagged. In 2019, also renal replacement therapy was also an important focus in the pediatric renal or kidney population, in the social media platform, wherein there were 51 tags, or 38.34%, and 133 threads were tagged in total. Descriptive analysis surrounding peer support was highlighted as a critical entity for the pediatric cohort, and where there were 38 tags, or 30.40%, and a total of 125 topics, 125 threads that were tagged in around peer support. Nursing tag was also important. Analysis highlighted that 35 tags, or 30.43%, and a total of 115 topics were 115 threads were tagged in around nursing, in the pediatric social media platform. Lab tests and biomarkers topic tagged analysis revealed 29 tags, or 27%, and a total of 109 threads were tagged. 109. Psychological support, also in the pediatric young people cohort, 21 tags were identified, or in around 27%, and a total of 91 threads were tagged specifically. Biopsy and surgery was also important. 33 tags, or 36.26%, and 91 threads were tagged in around biopsy and surgery. Lifestyle was also important topic in 2019. 25 tags, or 19%, and 25 25 threads were tagged in around looking at lifestyle, and at the same time. At the same time, a trend also revealed that wellness and well-being in 2020 was important. There was 14 tags, and 23.33%, and a total of 60 topics that were tagged in around wellness and well-being. In 2019, topic trend highlighted in the pediatric cohort, that physical activity was popular. There were 18 tags, or 31%, and 59 topics, 59 threads were tagged in around looking at physical activity. And in 2019 analysis also revealed primary care was important. There were 20 tags, or 18.75%, and 64 threads were tagged in around primary care. And finally, in 2019, in the pediatric cohort, there was a trend, also the data descriptive analysis over the 6-year duration also highlighted that electronic patient records, or EPRs, was popular. There were 12 tags, or 20%, and around 43 threads that were tagged in total in around electronic patient records. that draws this audio podcast in line to this Bostix Titus issue in around looking in around as part of this overview, and this audio podcast as part of the SZtorm, and as part of another Storm Bostix production.